Hi everyone, my name's Tanusri, and today I'll be talking about the impact of COVID-19 on stroke treatment in Latin America. So here's just a little bit about myself. I'm a rising senior at Mission San Jose High School in Fremont, California, and I'm really passionate about medicine and neuroscience research, and I hope to become a doctor in the future. I also co-founded a BioWonders International Youth Biology Workshop where we teach underprivileged students biology and the various concepts of biology. And I'm also a bass player at OSYO, which is Oakland Symphony Youth Orchestra, and I've been playing the bass for about 6 years now. So just as an introduction, I'll be going over what stroke is and a little bit about my project and also how it relates to global health. So as a part of this project, I'm an intern at MT 2020 Plus, which is a global health campaign launched by Society of Vascular and Interventional Neurology, one of the largest stroke organizations across the world. And the goal of MT 2020 Plus is to accelerate mechanical thrombectomy, which is a type of stroke treatment across the world. And there's a lot of misconceptions about what stroke really is, but it occurs when something blocks blood supply to part of the brain or when a blood vessel in the brain bursts. And this causes parts of the brain to become damaged and nerve cells to start dying. And there's 3 different types of stroke that people should know about. The first one is ischemic stroke, which is the most common type of stroke. And about 87% of all people who are affected by stroke get ischemic stroke. And then there's hemorrhagic stroke, which is the least common type of stroke. And then finally, transient ischemic attack is when blood supply to the brain is blocked for 5 minutes or less. And stroke is a major global health issue because it's a significant cause of mortality in several countries. Over 15 million people suffer from stroke every year, and at least 5 million people die from stroke. And 10% of all the deaths are due to stroke across the world, and this leaves at least 5 million people to become permanently disabled. And stroke affects different types of people that live in different environments, have different public health policies, different healthcare systems, and also different economic statuses, and thus it's known to be such a important global health issue. So as a part of this project, I studied the effects of COVID-19 on stroke treatment. And to begin with, I did an in-depth analysis via secondary research through databases like PubMed and NCBIA. And I contacted about 100 neurologists and neurosurgeons across Latin America in countries like Brazil, Peru, Argentina, Costa Rica, and more. And I created a survey and interviewed them to understand the barriers that they're facing in their hospitals and eventually to develop a solution. So now we'll be talking about the data and analysis part of the project. So here are some of the questions of the surveys that I asked these doctors, and these are just some of them, not all of them. And 56.3% of the doctors said that there has been a shortage of staff during the pandemic, and 64.3% of them said that there has been a delay in receiving stroke care. And as you see in the picture, some of them said that there has been this delay because a lot of people don't know what stroke really is, and they weren't able to recognize these symptoms. And the more delay there is, there's the less chance that the patient is going to survive. And 44% of the doctors said that there has been up to 4 hours of delay in receiving stroke care. And again, because of this, there's a high rate of mortality. A lot of people would not be able to survive. And these are some of the top barriers that doctors mentioned that they're facing in Latin America. 50% of them said that there has been a transportation delay because Latin America is such an underdeveloped nation. A lot of patients aren't able to transport themselves to the hospitals. Educational barrier was also a very important one because a lot of people don't know what stroke is. They aren't able to recognize the symptoms and treat it as fast as possible. Rehabilitation was one of the top barriers as well, and although it doesn't directly have to do with stroke treatment, it does play a role in the recovery of the patient, and 50% of the hospitals said that there has been no proper rehab during this time because a lot of the hospitals have changed into COVID-19 centers. And here are some of the recommendations that doctors gave in order to solve these issues. There are just 2 of them right now, but there's a lot more. And some of them said to promote telemedicine, as in the United States, telemedicine has become really prominent, but in Latin America, there's no such thing as telemedicine really yet. And some doctors also said that in order to reduce this educational barrier, we should launch campaigns and post on social media in order to educate people about what stroke really is. So next I'll be talking about my future plans and goals. So currently I'm working with a doctor in Latin America to create an app which tackles the rehabilitation barrier as well as the educational barrier of stroke. And basically what this app does, it educates people about what stroke really is by allowing them to read the latest news on stroke and understanding the symptoms of stroke. And it also allows them to connect with therapists online so that they don't have to transport themselves to the hospital. And also there's a lot of exercises that are given by the therapists themselves in these hospitals, and they can do it at the comfort of their home. So finally, these are some key takeaways of the presentation. The first one is that the main point of this presentation was to understand the barriers imposed by COVID-19 on the healthcare system. And some of these barriers I've mentioned before, such as the educational barrier, transportational barrier, and the rehabilitation barrier. And also the main point was to bring these barriers into light for public health officials to take action on. So as a part of NT 2020 Plus, I'm working with the doctors in Latin America in order to solve this problem that hospitals are facing. And the final key takeaway is to understand the importance of rehabilitation and how it can be improved, which is what we're doing through the app. So here are the references that I used for my presentation. And finally, I would like to thank MT 2020 Plus, my mentor, Tanya, Dr. Anurag Mairal, who's a professor at Stanford University, and Dr. Dilip Yavagal, who's a neurosurgeon, and Gitanjali for giving me this wonderful opportunity to work as a part of this organization. And I would also like to thank the Global Health Leaders Conference for giving me this wonderful opportunity. And finally, I would like to thank all of you guys for listening to my presentation. And here's my contact information if you would like to contact me for any further questions. Thank you guys all so much.